Hi there.
Hiya, welcome on, how are you?
I'm good, thank you very much,
Good to
Dr.
see you.
Omid. We are in Kissdental Bramhall.
We are, welcome.
Yes.
It's a beautiful village, it's a new Kissdental practice,
Yes.
one of our newest ones.
Just tell us a little bit about what sort of dentistry happens here.
So we're mainly focused on cosmetic dentistry. We do everything, of course, we do that, the general dentistry, but a lot of porcelain veneers, composite veneers, implants, and then a lot of orthodontics, which is my area.
Yeah.
A lot of Invisalign.
And so this is the first space that your patients will see when they arrive.
Yeah.
Is it usually check in at a reception and then take a seat?
Yeah,
Gives
check
a bit
in
of a
at
flow.
reception, make them a drink, have a seat, get some tunes on, and and then the dentist will normally sort of greet them, take them through to the surgery from here.
Roughly how many surgeries are in here?
We've got 3 at the moment, but it's quite a big practice. There's room for more.
All
But
right.
It's about 6 months old, I think this one's
Okay.
still growing.
So very, very new. Are you able to show us some of the rooms?
Yeah, absolutely. Follow me.
So what is happening here? What happens here?
So this is kind of a treatment coordinator room. Now we don't actually, the dentists do their own consultation, so it's not per se have a treatment coordinator seeing patients, but once they've seen the patient, had a chat, come up with a plan, then one of the reception team will often take the patient through here and go through some of the more boring sides of the treatment, the payment, so the appointments and that kind of thing. So that'll be in this environment, kind of away from the reception area.
Something that people that are watching won't get is the smells as well. The smells real nice in here. Is that something intentional across the practice?
Yeah, we do actually have specific candles that we use. So there's a similar smell that you'll find.
What's happening in here?
Well, this is where the magic happens, of course. This is one of the 3 surgeries. So we'll bring our patient through for the initial consultation, have a chat with them, have a look at the mouth, come up with their own personalised plan. Yeah. And obviously this is where we do the treatments.
Do you find that a lot of people are quite anxious, nervous? Or what's it like?
I think less so for me now, because I'm really just doing the ortho, and I think by the time they get to that point of their journey, they've done all the stuff that they were the most anxious about, the general dentistry. But of course we do see a lot of nervous patients, and we do offer sedation for those patients as well.
Yeah. And in terms of the nurses that you work with, is it usually similar nurse? How does that work between
I
dentists?
usually have the same nurse, where possible. We have the same nurse with each dentist, so my nurse has to get dragged around 5 different practices like across the week.
What's your normal flow like? So you've gone and collected the patient from reception, you've brought them in here. How do you ease into conversation? How does it happen? Or you go straight into taking their clinical records?
Just go straight in, no chat, just literally dive in. No, bit of a chat on the way down. Yeah, I'll try and not look in their mouth for at least a good few minutes before. Have a bit of a chat first about something not to do with teeth.
Once you've done that, build the rapport, and actually then assess them, how do you then hand over for the treatment coordinator room? How does that work?
Yeah, I'll sort of go out and I'll sort of hand over to reception. My nurse usually will have put a plan together in the background, printed it off, and then I'll kind of quickly hand over to reception, and then I'll come and get the patient and take them out for them.
What are some exciting things about working, I guess, in here in these surgeries and getting to meet the patients? What do you enjoy the most?
I love the ortho journey. I love the fact that you see these patients for quite regularly for 6 months, 12 months, even longer sometimes. So I like seeing the development of that patient from when they first come in, often being self-conscious of their teeth, and getting to know them over those frequent visits, and then seeing them sometimes as like such a more confident person by the end of their journey. So that's the most exciting bit for me. Cool. So this is a CBCT scanner. So I use this more often than not for a OPG at the start of ortho. So
what's it telling you that you need before patients have orthodontic treatment?
Well, it's so important, as you know, that we're checking the health of the teeth, checking the roots, checking for any pathology, checking the bone levels, checking for unerupted teeth, and the root positions are pretty helpful to know too with ortho.
So there's direct to consumer aligners where people just order them online. So I guess this is something that you wouldn't be necessarily getting.
Yeah, definitely not.
Yeah.
The number of times you take an X-ray and there's something that you didn't expect to see, like there is an unerupted tooth or a supernumerary or whatever, or some short roots, and you think if they'd have gone down that route, they would have had some serious trouble.
I just want to find out a little bit about how you actually got into dentistry. Was that something that you always wanted to do? Family members in dentistry? How did that come about?
It's not something that I like grew up wanting to do necessarily. I wasn't sure what I wanted to do for a while. I was really torn when I was at college between law and dentistry. Those are my two things. I knew I wanted to do something at uni where I would come out of it knowing what I was going to do and have a job, but I was never fully set. I'd had a little bit of experience with dentistry on the receiving end of it, with having braces myself for sort of 3 or 4 years, quite a long time, and kind of thought, yeah, maybe this is something I could do. But yeah, it wasn't something that I was totally set on. I went to uni in Sheffield. I enjoyed my time at Sheffield. It was a really good uni. But even through uni, I wasn't fully convinced that like this is for me, this is something that I love. I kind of got through it, qualified, did a couple of years, and wasn't that enthusiastic about it really. When I was doing general dentistry, NHS work, I didn't really enjoy it that much. I didn't have the passion for it.
Whereabouts were you doing that general dentistry?
Mainly over in Wigan, in Greater Manchester. So quite a high needs area, lots of NHS work to do. So a good place to learn and to get that basic experience of looking after teeth that you're looking after. But yeah, I wouldn't say I had that passion or that fire, and it was really only once I started doing ortho that I found something that actually I really love doing. And so I've just gone all in on that for the past sort of 10 years since then. So this is our super exciting decon room.
Yeah. This is where you make sure that people are being kept safe and clean instruments are being used.
Absolutely.
So how did you actually transition into ortho from doing general dentistry? How did that transition happen for you?
Very gradually, really. I started it when I was still at an NHS practice. I went on a couple of sort of short-term ortho courses. It was 6 months miles back when I started doing it, and a few aligner ones. ClearStep was the one that I used. And obviously I knew very little, only what they teach you on those days, which is not a lot. But I started doing a little bit of it, picking some simple cases, and I thought, actually, this is great. For once, I felt like I was working, but I wasn't working, and actually enjoying it. Then I started to do a few more comprehensive courses, some full day courses, and then a big one that I did then was London Orthodontic Academy, which was a year-long course, specialist-led, where we were hands-on with patients, with a proper orthodontist holding our hands while we were doing it. That was the one where I think I really learned the most. And then around that time started working at Kissdental. There was an orthodontist that was leaving who was able to help me a little bit too, to start to take on slightly more complex cases and start to do it properly. Because I think when you just start out, if you've just done an Invisalign course or you've just done a 6 months miles course, they kind of set you up as if, off you go, you're ready to go, you know what you need to do. But actually, once you start, you realise you know nothing.
How would you evaluate you starting out in aligners specifically, and how you approach aligners now? What would you say are some things that have changed in the way you approach it?
It's completely different. I had no idea what I was doing. I was asking for help at every step. I think now the treatment planning is easier. I think back then when I was using ClearStep, you wouldn't even see a clincher like you do now. So it was quite different. Obviously we were taking impressions, we didn't have a digital scanner. I was looking a lot less at the important things, the etiology, what is causing this malocclusion, how can I fix it. The way I plan it now is with the end goal in mind, and looking at what's causing the teeth to be how they are, and how can I realistically get them from here to here in a way that's actually going to happen. When you're just starting out, you don't see any of that stuff. You just see, okay, well, they're not straight. Let's use this thing that someone's told me can make them straight.
Yeah, I find that nowadays when I see the patients for the very first time, I'm already thinking at retention, how are we going to maintain your result? And I'm sort of working backwards. Whereas before at the start, I would just be saying, hey, the clean check says we can do this, and then you fall into all kinds of issues that way. What's a typical day like for you at the moment?
Well, yeah, I'm at a position now where I can basically just do ortho, which is great. That's what I've been working towards for the past few years. That's what I enjoy. And so now I have to, my day at work doesn't feel like a day at work. Yeah, it'll be a mixture of hopefully some new consultations and some treatment planning, and then lots of reviews, a mixture of aligners and fixed cases. The only other bit of dentistry really that I still do is just a little bit of composite bonding, just for some of the, finishing off some of the cases. But we've got some super talented dentists at Kiss that do more of that than I do.
One thing you told me is that you work between 5 practices, soon to be 6. Why would you do that to yourself?
Well, I like to keep busy. If you keep moving on, you can't annoy anybody too much at any one practice. But no, it's just, for me, I'm the most experienced person with ortho within the group, so it's for me to stay busy, I can kind of use my skill set at different locations, get those referrals from the dentist, and kind of take on the more complex cases at each location. And I find the week goes super quick when you're working at different practices. When you're in the same room, like day in, day out, for me, it's a bit more of a treadmill, and you kind of...
I'm always thinking, will you just never turn up at the wrong place on one of the days, and it's like...
Yeah, touch wood, I've never done that. Sometimes the patients do though, because some of the patients will follow me actually from one practice, they'll say, actually I want to see him over there next week, and then they'll go to the wrong one. But touch wood, I've not done that yet.
What are some of the negatives that people might not realize about how you're structured to work between different practices?
For one thing, I've got to carry a lot of stuff around with me, because each practice, it's hard to keep an inventory of all the different stock that I use when I'm only there one day a week or one day every 2 weeks. So I have to physically carry a lot around with me. It's like unpacking for a weekend away every time I get to work. And I suppose with time off as well, trying to structure patients' appointments, if you're there only every week or two, it's sometimes, occasionally for patients, it can be difficult if, I'm only there at a particular time. So I have to be a bit flexible and sometimes see them somewhere else, or occasionally they might have to see somebody else if I'm not there. So little administrative things, but I think on the whole it works quite well.
If you're talking to someone who's starting out in their dental career, they want to do something similar to you, what would be the building blocks to getting to where you are? Would it just be diving straight into private practice, ortho? Like, how do you get to a level that you're at?
Well, I think it's important to have a bit of a grounding in everything. So I see a lot of young dentists, they just want to go straight for, cosmetic dentistry and straight for the big Instagram account and stuff, which is great, but I do think having a bit of a basis of treating regular patients and doing a little bit of everything is important. And it helps you find the bits that you like and the bits that you don't like as well. So do a bit of everything first, but then once you find something that you enjoy, focus in on it, do a lot of reading about it, do a lot of courses, find some people that are good at it, and try and pester them and follow them and learn from them, and just teach yourself as much as you can.